Welcome to the Fifth Avenue Doctor's Consultation on Cosmetic Surgery and Dermatology with Dr. Louis M. Fetter, board-certified dermatologist and cosmetic surgeon. Dr. Fetter is the author of About Face, published by Warner Books, and is the host of his long-running cable TV show, Here's Looking at You. Dr. Fetter has also hosted a series of nationally broadcast skincare specials with John Davidson, Juliette Prowse, and Richard Bay.
Hello, I'm Dr. Louis Fetter. In recent years, the fields of dermatology and cosmetic surgery, or as I like to call it, appearance medicine, has undergone exciting new changes. Just since 1987, when I released my first video on the subject, new and innovative procedures have been created. I am proud to say that I have participated in the development of many of these new and innovative techniques. But why has there been this explosion of new developments in the field of appearance medicine? The answer is quite simple. You have needed and wanted them. All over the world, people have come to realize they do not have to accept the appearance nature has given them. They have come to understand that looking good and feeling good really go hand in hand. When you are happy with your appearance, you are in a much better position to accept the challenges of your life, whether it's your professional or personal life. In this new competitive world of the 90s, we all need to be at our very best. You know, it wasn't that long ago that appearance medicine was generally available only to the rich and famous. But recent developments, especially in the fields of dermatology and cosmetic surgery, have reduced the costs and time required to attain dramatic results. Yes, the prospect for a better-looking you is just within everyone's reach. I can't begin to tell you about the incredible changes I have seen in my patients' lives because they made the decision to look as good as they can and should be. For some people, it's correcting severe flaws like acne scarring or other disfigurement or other skin abnormalities. For others, it's reducing the effects of aging and adverse environmental factors. And for those who have been fighting the battle of the bulge and other lipodystrophies and losing this war, amazing results can be achieved through what I call liposculpture. Developed in France by Dr. Pierre Fournier, it is not merely liposuction, but rather an active and dynamic technique that actually sculpts the body, and that I do entirely by hand and not by machine. I have operated with Dr. Fournier and have personally completed more than 2,500 cases successfully. It makes no difference if the results obtained are subtle or very dramatic. For that individual, it represents a change for the better. And it's amazing how one good thing can lead to another. A small change in the way you look and feel can change your entire outlook on life. And that can change how you relate to others and how others relate to you. Before you know it, your life can undergo a total transformation, and all just because you took charge of your life. But what are these new procedures? What can they do? What kind of results can I expect? These are the questions I am asked every day at my Fifth Avenue office, on my weekly television program, and at lectures I give worldwide. Well, that's what this new instructional guide is all about. It's your private consultation on the very latest procedures and advances in appearance medicine. Through the following demonstrations, I will show you the newest techniques that are available to help you change the way you look. I will show you how the procedures work. We will discuss expected results, recovery time, and I will even tell you about possible discomfort, if any. The more you know about a procedure, the easier it will be to make that all-important decision if it's right for you. I believe very much in non-interventional surgery, procedures that don't necessarily involve cutting, where we work under the skin to enhance the body's natural contours. I have been one of the first doctors in the United States to work with Dr. Pierre Fournier and develop a technique called autologous tissue transplantation. We take tissue from other parts of the body and we place it throughout the face with no scar, and there is no visible incision. This procedure is so far advanced, in many cases it precludes facelifts. Although I do facelifts, and we also do the special curl lift, which involves an incision in the hairline, running a suture under the skin and tying it up without any incision. Many times all a patient needs, especially middle-aged patients, is replacement of the fibrofatty tissue in the lattice type structure, where we come in many sites around the face, and we're going to show you some befores and afters of this procedure. This is probably one of the most sought after procedures in our offices, in addition to liposculpture, where we liposculpt, for example, the neck or the arms, belly, hips, thighs, and I perform almost 3,000 body sculptures, mainly by hand, using the tumescent technique. Later on in this tape, you'll see other procedures that we have advanced, and we're talking now mainly about the newer, more up-to-date procedures that you at home have heard about and have seen and may have some questions about. So in addition to the autologous tissue transplantation, I'm the first doctor in the United States to use the Aptos threads. We have special threads that we implant under the skin. I was working with Dr. Sulaimanidze in Moscow, where I learned this technique, and I showed him my technique of autologous tissue transplantation, and now it's called the Aptos Fetter Lift. And we use the threads in the forehead, after using Botox first to raise it chemically, and then mechanically we put the special threads under the skin. You're back to your life the same day, and that raises the eyebrows up anywhere up to a quarter of an inch and more. We also put the threads sometimes in the face to support the cheek area, and sometimes in the neck after liposculpture. This is a very, very advanced procedure, and there's no downtime, there's no scar, and the results are phenomenal. Intense pulse light is one of the newer advances, far better in many cases than merely laser. Intense pulse light is good for acne and acne rosacea and redness and for discoloration, and just in general to combine light chemical peel with intense pulse light to make the skin smoother, more homogeneous, and really make the skin sometimes 15 or 20 years younger. And also, in many cases, it can help prevent skin cancers and other keratoses from developing, because as a dermatologist also, we see a great deal of melanoma, skin cancer, discolorations, and keratoses. So any of you who have those things, please bring it to the attention of your physician or call our offices. We'd love to be able to see you and begin a relationship with you. Now, in addition, we didn't have the concept of Botox even a mere 5 years ago. Botox is a derivative of botulinum toxin, which is purified and diluted, and what it does is it's wonderful for the fine muscle relaxation around the eyes, in here, the forehead, and many areas here, and the platysmal blends in the neck. Now, Botox is very useful. It lasts anywhere from 3 to 6 months, but as I mentioned, using Botox first for the forehead, 5 days later I put the threads in, I can mechanically keep the elevation and the forehead a permanent elevation, because as we get older, the eyebrows unfortunately come down below the orbital rim, and in years past many doctors were doing very extensive surgeries such as endoscopic brow lifts, which in my opinion are not that much of a gain, because it's a very invasive, very expensive procedure involving a great deal of cutting, and when my Aptos threads combined with the actual initial Botox will do the very same thing for a fraction of the cost with no downtime and no scarring. Different fillers we've used in the past have been collagen, which we don't use anymore. We use hyaluronic acid, we use medically pure silicone, and we love the use of fat. Those are the main three things we use in our offices, although there are literally 50 different fillers worldwide. I think a doctor has to feel comfortable with the fillers he uses and to be uses on the patient for the different indications. We do a lot of lip augmentation, we do nasolabial fills with both, as I mentioned, the fat or the medically pure silicone, or of course hyaluronic acid. Restylane is the best known of the hyaluronic acids. Try some of Dr. Fetter products. We're now in 20 countries. We have more than 100 Dr. Fetter treatment products, which you can go online and see fettermd.com and see our products. You'll see some nationwide in many of the major department stores and of course online. And here's a patient who had come to me 3 weeks ago for autologous fat transplantation of the nasolabial area and around the mouth. Let's go back and see that original visit at this time. Autologous fat transplantation is part of the greatest breakthrough in cosmetic surgery in the last 50 years. In so doing, a procedure that basically is a fat graft, I'm taking fat from this patient's right hip in a special manner in a tumescent technique. Tumescent meaning hard. By injecting special solutions, I can literally cause the blood vessels to stop bleeding, there's no pain, and I can get a hard surface where I can harvest live fat cells. I later take these fat cells, wash them, concentrate them, clean them of debris, and put them other solutions in to give them longevity. And after doing other procedures to them, I inject this fat into other parts of the face or body to rejuvenate areas that have been aged or have had trauma or things of that sort. In this particular patient, we're taking fat from this area and we mark it up in a manner like this. And after injecting the special solution and waiting a half an hour and applying ice, I will take this fat and re-inject it back into the face to rejuvenate areas that have been lost through the aging process. This is why in most cases facelifts are not necessary. Merely cutting and pulling skin does not replace giving back to the body what it already needs, that is fat. I compare this to a balloon. If a balloon loses air, do we put more air in the balloon or pull the skin of the balloon thinner? Obviously, putting more air in the balloon is the proper answer. And in so doing, in this case, we're putting fat back into an area which has lost its fat. In addition, 50% of the fat that I inject through this technique will be a permanent improvement. So after 2 or 3 times, and even sometimes even 2 times, this is a permanent correction of atrophied or loss of tissue. May I have the special opener and injection first. I will now inject a special solution into the area. I now will open the area to receive a larger cannula, and there's no pain at all during this procedure. As you see, the instrumentation is very mild, very blunt, very thin, causing no irregularities, and there's literally no pain. I will start to expand this area now with several injections of this material. Good. Now I wait about 30 minutes for the area to harden and for the blood vessels to close down, and there will be almost total anesthesia in this area with no pain or discomfort. Now the tissues have already been hardened, and I'm already harvesting fat from this patient's right buttock. And this fat, of course, that will be washed further and cleaned, and the patient cannot reject this fat. This is her own. This is basically a fat graft of live fat cells. Just like we graft skin, we're grafting fat. And the period of time, this improvement to her face after I inject it will be a permanent improvement by up to 50 and 60%. Now, in addition to using this fat before it's further treated, I can take additional amounts of fat and freeze it to be used at a later date for the patient's facial augmentation. At present time, we have over 1,000 patients' fat frozen in our special freezers to be used at a later date. Of course, only the patient's fat that is frozen can be used again on that same patient. That is, one patient can't share another patient's fat for obvious reasons. Now, in this case, notice again how clear and creamy yellow this fat appears after being washed and concentrated. Now, in addition to doing autologous fat transplantation or live fat cell transplant to the face, I'm going to inject the nasolabial areas. I'm also will be injecting at that same time from that same opening site what we call the marionette line, which is around the mouth, the perioral area, which also seems to exhibit atrophy very frequently in the same way the nasolabial area does. So this is bilateral. I've already marked this out in a special marking pen. At the same time, this patient is also going to have liposculpture about the neckline. She has a bit of a double chin, as you can see here. I've already marked it out. So by liposculpting this area, literally without any incision mark, I'm also going to do liposculpture about her jawline, about the mandible in here. So I'm coming from 3 sites, one site here, one site in front of each ear, and literally after one tiny suture is put into these sites, one will not even be able to tell how I was able to perform this surgery. There'll be almost no bleeding, and there's almost minimal pain or the slightest amount of discomfort. So as you can see, she's already marked out, and she's ready to be treated. Now, we've already made a small opening site at the area next to the mouth, and I go in now with my fat, open your mouth please, and and I inject into this area, fill the nasolabial area up, and from the same site, I fill up the marionette area. And then we will go ahead and I will liposculpt the neck after finishing off the left side of her face. I inject as I withdraw my cannula. And from one site, on both sides of the mouth, I can literally do the entire face. There is no pain here and no discomfort. The patient will be back to her work within a day. We apply ice, give the patient some prophylactic antibiotics, and this will be one very happy patient. Other areas that I can augment is the glabella area between the eyes. Sometimes I put together areas such as the cheek area, the malar prominences, to build up cheekbones. Also, there's usually very often a depression around the jawline. I can build that up. And even the chin, I can build that up because this particular way I do this procedure, I have a manner in which I can remove the periosteum, which is a covering of the bone, and allow fat to live and become a graft right against the bony tissue itself. So I can build it up. Fat has also been used in such diverse areas as the breast. We can use it in the private areas of men and women. We can do it for hand rejuvenation, and a host of new and wonderful new techniques are being developed with the use of autologous fat transplantation. Now let's see how she looks 3 weeks after the procedure was done. Notice we improve the nasolabial areas, around the lips themselves, and the marionette lines, which are the perioral areas. I think you have a wonderful improvement. I'm very happy. I certainly hope you are.
Yeah, I'm happy with that.
Thank you. And now let's go to some other photographs of patients who've also had autologous fat transplantation. This 64-year-old lady consulted me for facial atrophy and facial rejuvenation. After full autologous fat transplantation to the nasolabial area and the lips, in addition to a chemical peeling, we note in the postoperative how attractive this lady is now. This 78-year-old lady consulted me for facial rejuvenation initially. We did a mini lift, a chemical peeling, and autologous fat transplantation to her face. She then discussed the fact that her hands looked very tired and weathered. We performed autologous fat transplantation to both hands and a hand peel, and 10 days after the procedure, the postoperative photographs are self-evident. This is a very happy patient. This 80-year-old lady consulted me for facial rejuvenation. When we explained to her that a facelift would not be necessary, and we performed autologous fat transplantation and the chemical peeling, this patient appears more youthful and is very, very happy. Autocollagen is another modality which is used to fill parts of the face. Here, it is being injected in a 54-year-old man with nasolabial depression. Autocollagen is made from the fat which has been previously extracted from this patient's hip. This is a painless procedure, and the patient cannot reject this fat, being that it is made from the patient's own body tissues. This will last anywhere from 6 months to a year and a half. Autologous fat is longer lasting than autocollagen, as we are injecting actual live fat cells. In autologous collagen, however, being that we break the fat cell up for more superficial filling, this is not a permanent procedure and will last anywhere from a year, as I mentioned, to a year and a half. Autocollagen is useful for more superficial tissue defects than we use for autologous fat transplantation, which is primarily for major and deeper defects such as the nasolabial area and the glabella area between the eyes. Here's our patient now, and then 2 weeks later, and we can see the marked improvement made by the autocollagen. Here's another patient in her 40s who has had autocollagen in a period of 2 weeks, both before and then the after. Here is also another patient before and after being filled with autocollagen. Chemical peeling is one of the most important adjuncts in cosmetic plastic surgery. There are many different levels of peels, from the most superficial, which I often call a complexion peel, to middle-level peels to deep peels. More doctors today are avoiding the deeper peels because other things can be accomplished using a lighter peel or a middle-level peel over a period of time without the downtime, or what we call the marble facies, which can occur with the deep peels. When I say deep peels, I'm talking about phenol or carbolic acid, which is reserved really for the much older patient with some severe sun damage or scarring. Here's a young lady who has a low-grade acne problem and has some large pores, and today we're going to do what's called my middle-level peel. My middle-level peel is a combination of several different acids, including trichloroacetic acid and Jessner solution and other things that I've used over the years to give a patient a very enjoyable experience after this procedure is done. It's relatively painless. It takes about 20 minutes to a half an hour to do. The recuperative period is about anywhere from a day and a half to 3 days, but usually less. There's no work to be missed when a patient has one of the middle-level peels done. Now, an important consideration is the fact of pigmentation. Most patients have no problem. I've done this particular peel on patients of every racial and pigmentary group imaginable. Hyperpigmentation, which is darkening of the skin, can occur in some patients, but if there's any question about that, you can always test the patient behind the ear. In fact, this patient has had this procedure done about 6 months ago. Her acne is under good control, but it's also a refining type peel also. So we'll begin that procedure right now. This procedure is almost a mini facelift. And the reason I'm saying that is that the young to the middle-aged patient usually does not need to be cut around the ear and have the skin pulled back. Many patients just need a little augmentation with some fat in the glabella area or nasolabially. And actually the last thing a patient would need would be a facelift to improve that, because a facelift cannot per se make that better with an incision around the ear. So the patient today should consider these different avenues with their cosmetic surgeon. For example, chemical peeling, middle level and middle and perhaps deep, dermabrasion or a combination thereof, the operation that I pioneered called chemodermabrasion, the live fat cell therapy, of course home remedies to take care of the skin, the glycolic acid concept, retin-A. In addition to that, proper exercise, nutrition, vitamin therapy, exercise. These are things that must be engendered and must be kept in mind at all times to maintain a youthful, healthy appearance and to have maximal beneficial health. Now let's begin this procedure right now. We're going to begin now for this patient's problem. She has a mild acne and large pores, and her skin responds particularly well to the middle-level peel. This patient has been pre-treated in the past with some of our glycolic products as well as retin-A and other things we've been doing on her. So now we're first going to take off some of the superficial stratum corneum using some acetone. So as you see, I'm just cleaning off that face in a circular motion. This will be relatively painless. Sometimes the smell is a little strong, but that's about the extent of the situation here. And of course, recognizing that chest can be painted, hands, arms also need chemical peeling. So now she's been basically degreased using the acetone. Now we go to a special other solution. We're beginning the use of our first group of solutions right now. She'll take about 10 coats of that. The patient is holding a fan in front of her because it gets a little discomforting, but not bad. It's tolerable, and this seems to take away some of the discomfort by so doing. We cover the entire face, even around the eyes, the periorbital areas, the nose, and I even do the lobes of the ears to ensure uniformity. We come down to the angle of the jaw, and we go to our next coat. We'll do about 10 different coats of this one acid first, then we go to our second acid solution. As you see, a frosting is starting around the patient's malar eminences, the cheeks in here. This will go away very shortly, and the patient will be more or less fully healed within 2 to 3 days, even less. She'll hardly miss any work. This is the last coat of our first treatment solution. I've covered the entire face, as you can see, including earlobes, down to the angle of the jaw, the perioral area, which we are now. This is the perioral area. Then we go around the orbit itself to the malar prominence, or the cheekbone. We cover the nasal area, and of course the forehead. Right into the hairline. I think it's very important that when one does a chemical peel like this, one goes into the hairline for blending. You don't want a line of demarcation. It's very important, and I often teach this at chemical peeling courses that I give. We're beginning now on the forehead, the final solution of a trichloroacetic acid solution in a special base that we've developed. This special solution modifies the effect of the trichloroacetic acid so it doesn't go too deep, but yet it causes the amount of desquamation that I want. We're again covering the cheeks, coming down to the angle of the jaw, across the mouth, the upper lip. I go right to what's called a vermilion border, the nose. This is the glabella area. Again, to the malar prominence, down the sides of the face, blending into the hairline, and the earlobes, and now we're finished. My nurse will now put on some gauze pads that have been impregnated with a special solution to make the face feel more at ease. She will follow this with a special cream and some ointments that the patient will be instructed to use at home. I will see her again in 3 days, and I expect a very bright, clear, smooth complexion. 1 or 2 of these type peels a year, depending upon skin type, can ensure a very beautiful, clear skin. And now we're back with the patient. It's been 2 weeks after we've completed the middle level peel procedure, and as you remember, she's had moderate acne. You'll see her complexion is markedly improved, and she is breaking out less. Am I correct? Yeah. Not only that, the patient will probably have to have further treatments such as a middle level peel, or perhaps dermabrasion if the scarring persists or gets more severe. But that will be determined at future visits. And now let's look at some other patients who've had this procedure done. This 38-year-old lady had a very weather-beaten and unattractive appearing facial expression. On examination, the solar damage caused by prior sun exposure was very evident. We did a middle to deep chemical peeling on her, and this is how she appeared 2 weeks after surgery. This 53-year-old lady had severe wrinkling, hyperpigmentation, and a very mottled appearance of her facial skin due to both the aging process and severe sun exposure. After a chemical peeling using trichloroacetic acid and phenol, this is how she appeared 1 month after surgery. This 57-year-old lady had a very fair complexion and had severe sun exposure over many years. We decided to perform a middle-level chemical peeling in addition to some autologous fat transplantation. In addition, her lips were also augmented, and the post-operative photograph will show the excellent results that can be achieved. Chemodermabrasion is a procedure that I pioneered and introduced to the medical community more than 15 years ago. I, to date, have done more than 4,000 of these procedures. It is quite a unique procedure in the fact that I have combined chemical peeling and dermabrasion as one procedure. In this 1 hour operation, one can achieve anywhere from 75 to 95% improvement and better for acne scarring, active acne, facial damage caused by sun, or trauma. In addition, excoriations, which are scratches that may be self-inflicted, can also be corrected with this procedure. This procedure heals in anywhere from 7 to 10 days, and the patient must keep out of the sun for 6 months. But other than that, the healing is usually uneventful. It can be done in any pigment group, such as white patients, of course, black, Asian, etc. We initially apply an acid, which I make fresh that morning of the surgery. We apply that for anywhere from 3 to 5 minutes. Then it is neutralized. A full-face dermabrasion is performed under local anesthesia, with anesthesia already injected both into the face and the anesthesiologist having injected anesthesia intravenously at the same time. After the procedure is done, another application of a different acid is applied, and different dressings are then placed on the patient's face. There is almost no pain and no memory of the actual procedure using this type of treatment and anesthesia. Let's discuss our first cases of chemodermabrasion. This 24-year-old female came to me for the scarring secondary to severe acne cystica. Not only was the scarring present, but the patient had ongoing disease. We chose to do chemodermabrasion on her. The result has been an improvement of perhaps 90%. The patient is happy, and other members of her family who've had similar conditions have also been treated in this manner and have also responded beautifully. This lovely lady had a large amount of sun exposure. She lived in Florida, and as you can see, she had areas of hyperpigmentation, some fine wrinkling, and some early keratoses, which can be precancerous. We also elected to do a chemodermabrasion on her. She healed very beautifully, and we can see the post-operative results. She looks younger.